Knock, knock, knock. Hello, my name's Kiera. I'm going to be your nurse today. Can I get your name and date of birth?
Jane Doe, May 16th, 2000.
All right. And are there any allergies I need to be aware of?
No allergies.
Okay. At this point, I would come over and check the wristband to make sure all the information is correct, which it is. Now I can don my non-sterile gloves. And now I will make sure there is a mask on my patient and her head is turned away from the CVL dressing site. I now pull this back. I will assess the site, making sure there is no inflammation, redness, swelling, drainage, and of course I would ask my patient if she is having any pain around the site. Are you having any pain around your CVL site?
No pain.
All right. At this point, I would come over here. I would open my bag away from me, and I would carefully grab my mask. I will come back over to my patient, and I will grab all of the lines and remove the dressing. Of course, you want to go from the outside in, making sure not to tug on any of the lines. Of course, you want to do this carefully, making sure not to cause any trauma to your patient. And as you get in the middle, you want to make sure to hold this down and pull away from this CVL. At this point, you can discard of the dressing, and you can remove your non-sterile gloves. You want to read hand hygiene. And carefully grab your gloves out of your package. Alright, you want to use the pinching method, putting this glove on your dominant hand. And with the scooping method, you will put this other glove on your non-dominant hand. After the gloves are both applied, you can readjust as needed. I will grab my sterile field, making sure not to touch anything else. You want to open it. And slowly drape this over your patient. At this point, you want to get all your supplies and put it on your sterile field. At this point, I would open up my bio patch and also place it on my sterile field, but we don't have one. Using my gauze, I will place it over the lines and carefully grab all of the lines with the gauze, keeping my gloves sterile. I will grab my alcohol swab, and I will go from the site outwards, making sure to scrub it for about 30 seconds. And then I will leave my gauze on the lines and discard of the alcohol swab. At this point, I will get my CHG, pop it, making sure all the liquid comes to the pad. And I will grab the lines again with my gauze and scrub vigorously around the site for about 30 seconds as well. At this point, I can discard of both the CHG stick and my gauze. And I will initial, date, and time this. And not stretching, I will slowly place this over the site, allowing it to naturally fit over the CVL. At this point, your sterile filled is good and you no longer need it. You can remove your gloves, but for the sake of this video, I'm not going to be removing them. And you can discard of all your items. Again, you would peel this off with your initial date and time. You will place this over the patch. At this point, I will gather my supplies. This would already be in a package. I remove any air from out of here. And this would, of course, still be in the package. I would put this on here and prime it. And you can set this back on the table as long as the package is still over it. At this point, I will get my alcohol swabs ready. So you want to scrub around the port for about 30 seconds, making sure all of it is clean. You will slowly remove it and discard of this as well. You'll get your alcohol swab, cleaning off any remaining blood that might be piled up on there, and also discard of this. And then this still being in the package, you would take it out of the package and apply it on there. Once it is applied, you want to unclamp and make sure there is blood return and slowly pulsate to flush. After you are done with that, you can also discard of that and get another alcohol prep pad and rub it down for about 30 seconds as well. At this point, you can put the stopper on, and you are done with that. Whenever you cover up your patient, make sure all of your things are discarded, and of course you would document any of the equipment that you used, and make sure the bed is all the way in and all the way down, and make sure the bedside table is in reach, and call light is in reach as well. That is the end of my CVL dressing.